Hi, everyone, and welcome back to another episode of The Power to Prevent. This is a podcast where we talk about HIV, how to prevent it, and how those prevention methods can change lives. So, this is a limited series podcast under the BHA for Equality, which is a local charity in Manchester. And this is under the PrEP Project. And here to tell you a little bit more about the PrEP Project and what it is the lead of the project. We have Megan.
Hello. Hi, everyone. So, as Tomike said, I'm Meg and I'm a sexual health lead at BHA. And the PrEP project is a project that aims to encourage uptake, awareness, and access to PrEP in Black, Asian, and minoritised ethnic groups. So, we do that in lots of different ways. It might be group sessions and workshops in the community, it might be resources. We've also been developing a women's empowerment group where we educate women on PrEP and we reframe PrEP into a way of speaking about women's health as opposed to just something about HIV and sexual health. So there's lots of different ways that we've been doing that, but another one obviously is this podcast, and getting on amazing different guests to talk about their experiences in working in the community.
Thank you for telling us a little bit more about that because I'd like to think we have some new listeners and people who aren't really familiar with either the BHA or PrEP or, this podcast.
Mhm.
And Megan's right, we do have a lot of guests that come on. And for this episode, we have an amazing guest who has worn so many hats throughout the sexual health space and field and genuinely comes with a lot of experience and a lot of knowledge around this topic. So I'd like to welcome Chizor, do you want to give yourself a bit of an introduction? I feel like you can introduce yourself better than I could.
Oh, thank you so much for that. My name is Chizor Onwuegbute, and I live here. I live in Leicester. I'm a social worker here in Leicester. No medical background as such, but I am very, very passionate about sexual health awareness, about PrEP, about family planning in general. So thank you so much for giving me the opportunity to share my views. Thank you.
And thank you so much for coming on today. I genuinely look forward to the conversations we're going to have, and I think we'll really be able to draw on from your experience. So I just want to start by asking, and disclaimer, we have talked about this a little bit before we started recording, but I just want to ask a bit about how you got interested in sexual health and just a bit about your story that led you to this point.
Okay. Thank you so much, Tomike and Megan. I grew up in Nigeria, West Africa. And when I was growing up as a child, of course, and even as a young person, talking about sexual health in general was seen as a big taboo. And if you were seen talking about it, you could be perceived to be wayward or promiscuous or sexually active. And so it was something that you never just really get to talk about. And obviously, I went to a boarding school, a secondary boarding school, which was next to a convent, which even made it much more difficult to talk about sexual health. So the school was quite strict, but it gave you a very fantastic educational background. So, as I was growing up, living around, not being able to talk about sexual health in general, in my late secondary school or probably first year of doing my A levels, one of my older brothers bought me a book called Every Woman. It has a red cover and a silhouette of a lady on it. And as I read this book, I began to perhaps gain more insight as to how the human or the female body works, to understand my menstrual cycle, to understand what I need to do, to understand more about family planning and the different types of family planning and what women can do to, have a healthy sexual life. So this was my very, very first inkling as to what sexual health as a whole was. But however, coming on to being aware about sexual health in general, the interest continued to grow. And then in my secondary school years, I observed that people about my age, the community is very small. So everyone was having kind of relationship with almost everyone, and people knew about each other. And so it was a bit of a worry for me that what about, being safe? Were they using condoms? Why were they having several partners? Or why were the partners, going around with different people? And so I spoke to some of my peers within my group, and we came up with this idea to have, act plays about sexual health in the community. And we used to do that during Christmas times. We will act drama, talk about topical issues. And one of the topical issues that we talked about was to talk about family planning and having a healthy sexual life. Also, I'm from a very large family. Another reason that I became interested in sexual health generally and in family planning, because it all stems from my very keen interest about the subject of family planning. And I observed members of my community having a large family. I'm one of 10 myself, and they were struggling to pay school fees for these children and give them good, education or pay hospital bill. So I started talking about family planning with them and what they can do differently to still continue to enjoy sex as husband and wife, but without necessarily having children. Well, actually, my interest in HIV awareness actually started, way back from watching again people in my community, die of HIV or AIDS, if you like. And people were very ignorant and they were not aware of what was killing people. By this time, the awareness was really very, very limited. And so after visiting home, I thought to myself, what can I do to help people in my community? What can I do differently? By this time, I'm obviously living here in the UK. And while I was thinking about what to do, I started looking online about charities that do sexual health events or activities. And that's how I came across Terence Higgins Trust. And so I contacted Terence Higgins Trust and told them how interested I was in sexual health generally and, prevention of spreading of diseases, whether it was STIs or whether it was HIV. And they were kind enough to give me some boxes of condoms. I suppose at the time they were funding to be able to do all of these things. They gave me boxes of condoms, gave me leaflets and some and the video, some leaflets and the VHS video, which I traveled to Nigeria with. And so one of the best ways to spread information back home, you don't have social media, was to speak to the traditional leader in the community who would get a town crier to use this wooden gong to spread the message. And so over 2-3 days, there was message with a town crier going around village that Chizor so and so is come and she's coming to share some information with all of you, and children and young people from the age of 16 up to the age of 25, or any adult who wanted to come and join, should please come and join in the square so that she can share with you the information that she has. Of course, we didn't say that we were going to talk about sexual health. So when they came, we had set out chairs and tables, and there was, the VHS video ready to be played. And I started off by talking to them about sexual health, speaking to the young people. And when I asked the question if they knew what HIV was, or if they knew what AIDS was, people just put their head down, because as you can imagine, there's a huge stigma attached to it. And people would say things like, God forbid, it's not my portion. That is when their faith comes to play. It's not my portion. I've never heard of something like that. And I said, okay, that's fine. If you've never heard of it, that's what I'm going to talk to you about today. And we'll be playing a video. So we talked about sexual health, gave leaflets, and then played the video. And the greatest impact, I remember correctly, because I actually did get quite emotional and shed a tear. You can hear members of the community within the audience from watching that video. The video was someone from the Black heritage community, or the African heritage community, if you like, who was well. There was really nothing wrong with them at all. They were really very healthy. And then they had seen a doctor and they were told that they were unwell and had HIV. And eventually we watched this man, his health just continued to deteriorate. He had symptoms such as vomiting, symptoms such as poor appetite, loss of weight, and you could see him just losing weight gradually from every appointment to the hospital, and then gradually developed some rash on his skin. And I think what was interesting was listening to people in the audience saying, oh, that's the same illness that person had. That's the symptoms that person had. And we thought it was that elderly man or woman in the community who had been branded a witch or a wizard, that is killing that person through some black magic. That was really very, very impactful. At some point, I paused the video and encouraged people to speak among themselves. And you could hear from the audience, and it was kind of demystifying what HIV was. It was kind of demystifying what AIDS was. It was kind of demystifying these illnesses that it's been impacting on people in the community. Sometimes you say, oh, talk about the elephant in the room. In this case, this elephant wasn't in a small room. This elephant was a gigantic elephant in my community, taking lives. People didn't know what it was. And so being able to break the ice and being able to observe people talk about these themselves, I said to myself at the end of the day, even though I wasn't able to change everybody's mindset, which is literally not possible, but if I was able to make just a tiny drop in the ocean and impacted on one or two, three people who will be able to carry the message, who has become more aware about what HIV is, who will now remember to have safer sex, who will now remember that by having multiple partners, they are distributing these diseases as if it was some candy. And for me, that was some sense of satisfaction. Yeah. That was some sense of, Chizor, you have achieved. And I was really very grateful to Terence Higgins Trust, because when I asked for educational materials, I didn't know they were going to send me such a video that made such a huge impact to people in my community. And after that, people, some people came to my parents' house where I was staying in the village when I visited Nigeria to come and say, Auntie, well done for what you've done. It was really good to see that. It was impactful. And then, of course, we distributed the condoms that Terence Higgins Trust had given to us. Yeah.
Can I ask, do you think that the video, with the person in the video being Black specifically, helped in the impacts it had with people watching? Because I think it's very easy, especially within Nigerian communities, to kind of distance yourself from things like HIV and conditions like that by saying, well, well, it doesn't really happen here, or it's not because of that. That's more of like a European thing. It's more like a white thing. So do you think the patient in the video being Black helped with the impact?
It did, because you identify origin, they're from the same background. So it sends home the message. If you had used maybe perhaps a white person or maybe an Asian person in that video, they're not likely to relate as much. It might get them, the message across, but it wouldn't be as impactful. And so I think it's always very important that when, it's important that there is an effective communication. The other person is heard, they've received the information, and the message was clear. So yes, the person in the video and sharing the video with person of same color and same ethnic background really did help to drive home the message. Yeah.
And what do you think that the reaction of people when you did that session, do you think it was what you expected, or was it, I guess different to what you thought was going to be people's reactions coming into it? Was it a general consensus, or was everybody's reactions quite mixed?
Of course, like what I said earlier, I wasn't expecting to change the whole community. But a lot of people, majority of the people that were there that day did get the message.
Yeah.
Majority of the people that were there that day did get the message. There might have been a few that would shrug their shoulder and say no, but that's because they're probably leaning towards their fate and say, no, it's not my portion. It's not going to happen to me. But the message was very clear that what you taught, the illness that you thought that Mr. A or Mr. B down the road was suffering from because it was black magic, or because it was witch or wizard that had, given them that illness, that these symptoms are really very, very similar to what is happening to that person, especially when HIV, blossoms into AIDS, and you could see those typical symptoms arising, and eventually the person goes. Yeah. So most of them did get the message that day. Yeah.
Just wanted to ask, because you said you weren't going in expecting to change the community, which is fair, because you can't change people's minds based off one interaction. Fair enough. Because I think sexual health is something, and your views on sex as a whole, like the way you mentioned your brother buying you that book, your observations on family planning from such a young age, it's really ingrained in you from childhood, and it's something you carry into your adulthood. But did you have anyone who maybe their initial reaction was negative from the education they got from you that day? Their initial reaction was negative, but maybe after a while they came back and was like, that was really helpful. We needed to hear that. Were there any kind of receptions in line with that?
Yes, there were people who came back to me to say they were grateful and thanked me for, making effort to do that in the community, and that they were grateful for me sharing that. But obviously at the beginning, when you start talking about sex, as I said, talking about sex as a whole in our community, it's a touchy kind of subject. Oh my God, this auntie is coming to talk about sex, and people covering their faces and things like that. And at this point, they didn't know that there was going to be distribution of condom and things like that. So yes, when we first started, and of course we were talking about sex, you had a few people, murmuring or saying things in the audience. But when you started that video, at some point, everywhere was quiet. You could almost hear a pin drop.
No.
You could almost hear a pin drop. And then when we paused the video, I now said, just talk amongst yourselves to make it, encourage participation, so that I'm not just talking down, talking at them, if you like. So that encouraged some participation, and people talked about it, and people asked questions, and some people were asking questions like, so do you think there's AIDS, or do you think there's HIV? And of course, my response would be yes, that it is there, and we need to be aware that it's there, and it's not not just, AIDS that is there, but there are other sexually transmitted diseases that you could also get, and they all impact on you as a person. And some of them, if not treated, could go ahead to impact on your fertility, whether you're a man or woman. And so you could see people nodding their head. And it was me just saying, you need to be really careful, about having, intercourse, about having sex, about, we're not saying not to have sex, but have sex safely.
Yeah.
And I would say to my cousins and my nieces, I have two beautiful daughters, if the person doesn't have condom, just say no. Just say no. And I do understand, that there are times when there will be lapses, and you just hope and pray that one time it's not the time where that person is going to, have STI or have HIV, but that if they do, that they know what to do. If they're unsure, if they're worried about something, that they go and get tested.
Yeah.
Yeah.
I think it's so important, isn't it, to talk about that fear that was there and is still there in so many ways. I think, like in the UK, that so many people hold on to that image of the tombstone, and when you talk about HIV, for a lot of people, that it's still their mind goes to AIDS and all the fear and stigma that surrounds that. And as much as we want to try and get away from that stigma, it's so important to talk about it, because that fear was very real for a lot of people, and it still, is imprinted in what they believe now, and that's a hard thing to let go of. So I think you sharing that story of how actually that first switch, that first moment of people being like, oh, okay, actually, this is something that is important to us and that we should be speaking about. It is such an important reflection.
Thank you. Thank you. It's not just in Nigeria that I try and get involved. Here in the UK as well, as member of the African Heritage Alliance leadership team. In 2020, at the heart of COVID, we were busy doing a lot of webinars relating to health and other topical issues. We got involved. We talked about sickle cell. We talked about the increase in death rate among African heritage women during pregnancy. And we talked about prostate cancer. And of course, one of the topics that we talked about was HIV and PrEP. And that was when I met a fantastic lady called Shelley Batten and her colleague Esther Okon. They are champions, if you like, of sexual health here in Leicester. And so Shelley Batten was one of the people that spoke, during the webinar that we had. I must have been probably in April, but definitely 2002. And so we talked about HIV and PrEP in that webinar, and a lot of people turned up. And why did we talk about it? It was to break down those barriers. It was to break down those stigma, to create the awareness for people of African heritage and the general public as a whole. Sometimes when you attend sessions about health or other topical issues, people of African heritage are simply sometimes described as hard to reach, but we're not hard to reach. I'd like to say we are not hard to reach. It sometimes is the presentation. Sometimes is where the presentation is taking place. Sometimes it's who is doing the presentation. Sometimes it's how, the whole presentation is being conducted, if you understand what I mean. We just gave an example of watching a VHS video that had somebody of African heritage in it and showing it to people within the Black community. The message was delivered. They got the message. And I don't go around saying that, everybody in this audience or that's listening to this talk is going to have a change of heart today just from watching this. It's just that continuous engagement, that continuous talking that's going to get people to have a different perspective. So after that webinar, Esther and Shelley and myself, we decided to take this into the wider community by having face-to-face sessions at the African Caribbean Centre, because having it at the African Caribbean Centre, we hoped would encourage more people of African heritage community because of the center where it was being held, because of the community where it was being held, so that people can come out and participate and talk about PrEP and learn about PrEP and break down those barriers. So my interest is not just for people in my community back home, but also for people here in the UK, and being able to have those conversations and being able to create that awareness, and hoping that we'll continue to make tiny, tiny little change, drops of, little drops in the ocean, and eventually it's going to form a very big river. Yeah.
Yeah. Yeah, and I like that you mentioned, the message and like who it's coming from, and then also doing work in the UK where you're situated in like
Of course.
in black areas so that they feel comfortable coming to these places where they can learn about how to protect themselves. Because I think when we talk about PrEP, it's often in the context of a very westernized, very white communities. Like we don't often include Black people and really as well Black women within these spaces of prep and conversations and how we can best protect ourselves. So what has been the reception when you're holding these webinars and when you're doing these face to face?
I must say that the webinar was quite a success. We had a few doctors from the NHS, who were part of the discussion. There was Dr. Emeka Oloto as well, and a few other doctors. I'm trying to remember their names now. And of course, I think we also had the lead for Terence Higgins Trust, Tafat Zuar, I think his name is. He was also invited to that conversation. Um, the webinar was very successful. We had a lot of people in the webinar, but I must admit that the face-to-face session, was not taking up, it didn't quite go as far as we would want it to go. And that still tells you, obviously, that there is that stigma still out there. And also, another reason was we were just coming out of COVID as well, and people were still not feeling very okay about having face to face conversations and things like that. But one significant thing we did was that the leaflets that we printed out were left at the Caribbean Center, and people, kept picking up the leaflets. And we hope, because he has contacts and where to seek this help, we hope that some people who came to the Caribbean Center found themselves at the sexual health clinic here in Leicester and utilized the services that were available to them. And we also hope that the e-flyers that we shared through the various social medias that we belong to, both those of the African Heritage Alliance group, those from Ndibu Leicestershire, which is another big community here in Leicester, which I'm proud to be a part of, the Anambra State Association. We continue to share these e-flyers in these different groups. And we just hoped that, people found that moment where they said, I think I should go and get checked. I think I should go and get help, even if it wasn't to do with HIV, but perhaps other sexually transmitted diseases that they might have concern about. But we mustn't forget that within the Black community, it remains a very, very huge stigma. It remains a very, very huge stigma. And so people within our community are carrying some of this very heavy load and this very heavy burden just for themselves, because of the worry of sharing with their loved ones, because of the worry of sharing with their families.
So just to kind of connect to the two things that we were talking about, but you have had experience in Nigeria and you've also had experience in here, particularly in Leicester. So I, you probably had a lot of interactions and conversations with people where you've been able to have insight into their mindset before they've heard about PrEP and a bit of education about HIV and after. So, what do you think has been the impact of PrEP on people's lives, and what do you think has been not even just taking PrEP, but just learning about it? How do you think it has the power to change lives or has the power to change how people view sexual health?
It's a very, very interesting question. I know that when we had the webinar, there were lots and lots of questions being asked and creating that awareness and for people to have that awareness. The data or the analysis perhaps would lie with the sexual health team, with Esther's team, Esther and Shelley's team, who see people on a regular basis. But I know that people who have this information are empowered to go and seek help. um I've been asked questions, as to what you think. Do you really think if I go there that I'm going to be supported as a Black person? And all I can do is to encourage people to say, yes, no one's going to discriminate against you by going there because you're a Black person. But it is really difficult for me to draw that analysis to say, maybe give a statistics to say 10 people have been and they have benefited from it, especially within here in the UK. But for the people that I had the session with in Nigeria, you could see the reaction almost immediately. But here, people would ask questions and you continue to signpost and continue to encourage them to go and access the service.
Yeah.
Yeah. And
So that has been my experience, to continue to have that conversation about PrEP.
Mm. Well, I think the impact of stuff like that can't always be measured in, X amount of people attended clinic, X amount of people
Yeah.
access PrEP. I mean, obviously that's amazing if you get that increase, but like you say, it can be one person who's, excuse me, never had information about PrEP before and all of a sudden knows what it is. You don't know how many people they will reach with that information.
Yeah.
Even something like you say, it's seeing a flyer in the Caribbean Centre and seeing somebody else from their community talking about it. You can't always measure that impact in these ways. It doesn't tell the full picture of how important it is to have these conversations to get rid of people's anxiety around HIV, or at least try and lessen it. And
Yeah.
like you say, that word empowered as well, encouraging people and saying, actually, this can be empowering for you. You might not want to access it now, but that idea is in the back of your head in the future, or encouraging you to get tested, whatever it might be. And that's the real impact of it all, isn't it?
I think so. I think so, and it's important. But I think what's important about PrEP is that it's more proactive
Mm,
compared to PEP that we had before, which was more reactive. It was, the treatment after you're suspected to have had uh, been in contact or have HIV, whereas PrEP is much more proactive, encouraging you to be safe before even having sex, or it's it's very, very positive to know that PrEP it's out there, and much more positive compared to what we've had before. So it's good to continue to talk about it. It's good for us to continue to generate that conversation.
mm.
Yeah.
yeah, yeah. I want to thank you so much for coming on today. I think your experiences in terms of, just being able to be there when people first hear even about the concept of HIV, AIDS, or PrEP, and then also the analogy you drew on with PrEP being more proactive. It's something that you can take into your hands and just know that you can keep yourself safe and you don't have to rely on someone externally,
Yes,
is very empowering. And like Megan said, I think there are some things you can't just define in a statistic,
it's
just
true.
because X amount of people went to the clinic or X amount of people decided to start taking PrEP. I think there's no number you can place as a value on education, of now being equipped, because education in itself is just as empowering as a medication, as like they now know. And maybe they can think twice, or maybe they can bring it up in conversation with someone else, who can then go to the clinic, or who can then get tested, or who then decides to take PrEP. And that's something because of the actions, like you said, the ripple effect, because of what you've done, you're trying to ripple out good
Yes.
information and practices all across the community. And it's honestly incredibly commendable. So yeah, I just want to thank you so much for coming on and sharing that story with us.
Thank you. And one thing, I'd like to just add to this podcast is to tell people out there who haven't heard about it, who are hearing about it for the first time today, or who have heard about it before, to know that, PrEP is for anyone, irrespective of your color, gender, or race or ethnicity, to embrace it, to go for it, because you're keeping yourself safe. You're keeping generations of people safe. And that when you have been opportuned to have PrEP, to also kind of have that awareness that it is still okay and very important to go and have other STIs tested, because PrEP does not treat all the sexually transmitted diseases, and that it's important, irrespective of which group that you find yourself in, to continue to have this sexual education and check yourself with regards to other sexually transmitted diseases, and probably don't get too confident that because you now have PrEP that you shouldn't really have safe sex, because it's not just about you, it's for the wider community. So it's important to check yourself in other areas with regards to other sexually transmitted diseases. It's important to still have safe sex, even though you have been opportuned to have PrEP.
Meg, do you have anything to add to that?
No, I think, like you say, it's an amazing message to end with. I guess my final question would be, what do you want to see in the future of HIV and PrEP? Like what should the future look like for this area of your work, and what do you hope for?
That is a very important question, Megan. Um, that if I close my eyes now and open it, that everyone in the world knows about PrEP, and that they're having safe sex, and that they're kind of looking after themselves so that we can avoid the spread
Mm.
of HIV. It's also very important for me. Yes, the UK is my home, but I'm also from Nigeria, which is my home. I would hope that someday, I know that the UK government has only just made PrEP available on the NHS, not very long ago. My hope is that the leaders in the Western world, I know that they're continuing to, without sounding very political, but as we know, whether we like it or not, most things in the world these days are political. Without sounding very political, I know that they're reducing AIDS, to the developing countries at the moment, that they don't forget about our health issues, that they continue to support us. And we hope that someday that Nigeria, the country where I'm originally from, that people out there would have opportunities to have PrEP. That would be one thing that I hope that would happen. It could be a few years down the line, it could be however many years. But here in the UK, to continue to encourage people and empower people, knowledge, as they say, it's power. If you have that knowledge, you're able to access, you know where to go if you have that knowledge. And so, for people here in Leicester, I would say that our sexual health clinic is at the Haymarket, right at the center of town. And it's through the escalator or the stairway just by Matalan or by TK Maxx, and I hope that you can hear me. And it doesn't matter even if you're from Manchester, because Tomike and Megan are speaking to me from Manchester. But if you think too many people know you in Manchester and you want to come to Leicester, hopefully they'll be able to attend to you, even though you're not from Leicester. But to say that you can find the sexual health clinic right at the heart of Leicester's town centre by the Haymarket. Use that stair lift, use that escalator, and you'll be welcomed there by friendly faces on a confidentiality basis, as you know, who will signpost you, who would advise you, so that we can continue to break down these barriers, so that we can continue to re-educate ourselves, so that we can continue to share the message. That would be what I would like to see, Megan. I hope I hope I've not stretched and stretched and stretched it, but yes, that is what I'd like to see happen.
Amazing.
Yeah, yeah. And oh, more leaflets at the GP surgeries.
Gotta have the leaflets. Oh, well, thank
Yeah.
you so much for coming on and sharing with us. And Megan, as always, love having you on. This is your idea, it's your podcast. So yeah. And thank you both for giving me the opportunity to just have this conversation with you. And anyone who is listening, I hope you have taken any messages here to heart and just share it on with friends and family. Make the conversation more normal, make the conversation part of your everyday health check. It's the same as going to the GP, it's the same as taking your vitamins. It's just something you can proactively do for yourself. So yeah.
Yeah.
Thank you both very much for having
Thank you
me.
so
Thank you.
much.
All right.
Thank you.